My name is Grace, and I live in Berkeley, California. And I actually hate being on this side of the camera. I'm usually on the other side. I wanted to tell my healthcare story because I think it represents the dilemma that so many Americans are going through, which is choosing between keeping a job and their health insurance and being a caregiver. My story starts off in the early 90s when I met my husband, Andy. I had a great career, great health insurance, which was contingent on the fact that I made $30,000 a year. And in those days, it was no problem. In 2004, after Andy got diagnosed with Lewy body disease, Lewy body is a dementia much like Alzheimer's, where the person loses their memory and basically forgets how to do like daily activities. So I had to choose between my career and living and working in LA and keeping health insurance or becoming his caregiver. And naturally, I chose the second. And I tried to plan ahead, and I put myself on his health insurance plan. So my being on Andy's health insurance was still costing us like $400 a month. But this arrangement worked for a while. But as Andy's disease got worse, we started going through our money faster. I had to pay for adult daycare. I had to pay for other caregivers to come in and help. So at that point, I was faced with another decision, whether to keep myself on his healthcare plan for $400 a month or to save that money for his long-term care. And honestly, I really didn't know how long he would live. It could have been another 10 years, and we would have had to pay for an assisted living facility. And those cost like a ridiculous amount of money, like at least $5,000 a month. So again, I chose his care, and I took myself off of his plan. We fast forward to March of this year. In Andy's condition, suddenly it's like he falls off a cliff. And he was in hospice for 8 days and then died. And because I wasn't on his health insurance at that time, there was no way I could get back on. So then I get a letter in the mail, along with all the other bills one gets when someone dies, that my own health insurance plan has lapsed because I didn't meet the $30,000 a year minimum. If America had a public health option, Americans like myself would not have to choose between paying for health care insurance and being a caregiver.